Good afternoon, everybody. My name's Tadgh Crozier. I'd like to invite you to my presentation with the title, The Impact of COVID-19 Restrictions on the Resilience, Connectedness and Anxiety, and Comparing the Effects to CISGENDER, HETEROSEXUAL and LGBT individuals. The contents of today's presentation will include an introduction, my research question, talking about the current study, we'll go through the methodology, discuss the results section, and then we'll look at any future research and implications for the future. And at the end, I will be taking any questions. So I wanted to let you know just a little bit about me and kind of what led me to doing this research. I graduated with a first class honours degree in criminology and health and social care at Bangor University. I successfully and still successfully facilitate an LGBT social group in North Wales. I'm passionate about promoting resilience and connectedness within that community and the LGBT plus community, and my background and my experiences in addressing the impact of COVID-19 restrictions on mental health and well-being anyway. So I focus my research on the mental health and well-being of LGBT individuals in the community, because that is not only my experience of working with that group, but also it's my interest as well. So before we start talking about my research, I just wanted to tell you a little bit about kind of what has led us here today. In 2019, COVID-19, which is an infectious disease, first emerged and was identified in China in December 2019. It quickly went on to become a global pandemic. In March 2020, the UK government implemented COVID-19 restrictions. To control the spread of COVID-19, many restrictions were implemented, such as social distancing measures, mask mandates and lockdowns. These restrictions aimed to slow down the spread of the virus and to reduce the burden on healthcare systems and ultimately save lives. Some of the most common COVID-19 restrictions were stay-at-home orders or lockdowns, social distancing requirements, restrictions on gatherings and events, or limits on non-essential travel. This meant that there was an impact on social distancing measures. People were feeling anxious, isolation, loneliness, and grief because of the loss of loved ones. Before COVID-19 restrictions, adults reported that there was clinically significant psychological distress of 20.8% in 2019. In 2020, this had risen to 29.5%. That's a major increase. After COVID-19 restrictions, by September 2020, adults reported significantly psychological distress had fallen back to 21.3%. This shows that actually during COVID-19, that people were reporting psychological distress on higher levels, but as soon as COVID-19 restrictions stopped, these had fallen back to 21.3%. So with this in mind, we wanted to look at what is the impact of COVID-19 restrictions on anxiety, resilience and social connectedness of cisgender heterosexual individuals when compared to LGBT individuals. So after the discussion with the research group, we developed a hypothesis based on existing evidence. Our hypothesis is that the pandemic will have a more adverse effect on the anxiety, resilience and social connectedness of LGBT plus individuals during and after the implementation of COVID-19 restrictions when compared to their heterosexual counterparts. So although there are many definitions of anxiety, I feel that the American Psychological Association 2022 definition resonates with this research, that anxiety refers to the feelings of fear, worry and apprehension. Jewell et al. Study highlighted that COVID-19 restrictions have already affected people's anxiety levels by increasing their uncertainty and limiting their ability to cope. Muscola et al. 2022 study suggested that LGBT individuals may have higher levels of anxiety than cisgender heterosexual individuals, which were exacerbated by the effects of COVID-19 restrictions. So, to define connectedness, CRISP 2010 refers to connectedness as a sense of belonging and social support, which is essential for overall well-being and mental health. COVID-19 restrictions have had their effect on connectedness by limiting social interactions and increasing isolation. The disruption to regular social routines such as gatherings, events and communal activities have decreased opportunities for face-to-face social connections. Research such as McGowan 2021 highlights that LGBT individuals have lower levels of connectedness when compared to cisgender and heterosexual individuals. This may be caused by lack of social spaces and safe social spaces for the LGBT community. Also, social stigma and discrimination, which has led to exclusion and marginalisation, hindering connectedness. Hi, so our next slide is about our method section. We discussed using a quantitative approach in an online survey, as this allowed us access to a wide range of participants regardless of their geographical location. Also, this allowed us access to a larger sample size and allowed us to collect data in real time. Ethics was applied for and approved by the Ethics and Governance Committee at Bangor University, and all ethical issues were applied and adhered to using the BACP and the BPS ethical guidelines. As I identify as a gay man, I was aware of my own personal bias and potential limitations in the design of the research, and this awareness allowed me to remain neutral at all times throughout, so that my personal views didn't influence the interpretation of the results. So these are the measures that we used within our research. We asked participants to complete these scales before COVID, during COVID and after COVID about how they felt. The Promise Short Anxiety Form by Bevans et al. 2014, the Brief Resilience Scale by Smith et al. 2008, and the Revised Social Connectedness Scale by Lee et al. 2001, which we received permission for all three. An example of the Brief Resilience Scale is a self-reporting measure used to assess an individual's level of resilience. This refers to their ability to bounce back and thrive in the face of adversity. The scale consists of 6 items, each ranged on a 5-point Likert scale, ranging from 1, strongly disagree, to 5, strongly agree. An example of the Brief Resilience Scale is that one of the questions that we asked is, do you tend to bounce back quickly after hard times? Or do you often feel overwhelmed by daily challenges? Participants are instructed to read out each statement and select the response that best represents their agreement or disagreement. So the design of our research is that we asked participants who identified as a cisgender, heterosexual and LGBT across the globe if they would like to complete our questionnaire. They were recruited by word of mouth, social media and wellbeing services such as London Friend or the LGBT Foundation in Manchester. We used a repeated measures design. Independent variables were time, during, before and after COVID-19 restrictions, and our dependent variables were anxiety, resilience and connectedness. So the next slide we're going to look at is procedures that we used within our research. So we provided participants with an information form and a consent form. This allows for participants to decide whether they wanted to continue to allow and give their consent for their data to be used. They could withdraw at any time once they'd received the information about the research that they were engaging in. We asked participants to repeat 3 questionnaires on all 3 different scales before, during and after the COVID-19 restrictions. We also provided a debrief statement just in case any of the questions brought up feelings for the participants. We provided local services and national services such as mental health support that would enable clients to contact them and any of the researchers if any of the questions did bring up feelings. So on to our results. Our next slide shows the demographics of the participants who engaged in our research. On our first graph, you can see that we had 24 males, 83 females, and 2 who preferred not to say. And on our second graph, there was 59 heterosexual people, 14 gay or lesbian, 29 bisexual people, 2 pansexual people, and 5 people who identified as other. So in our next slide, you can see the results from our MANOVA analysis. The results of the test showed that the relationship between certain factors such as sexuality, gender identity, and the COVID period can change over time. However, when examining the specific interactions between these factors, there was no significant effects found for most of them. When considering the interaction between sex and sexuality, there was no significant effects found before or after the COVID period. However, during the COVID period, the combined influence of someone's sexuality and the sex was stronger, but this effect was not statistically significant. Overall, the results suggest that the relationship between these factors is complex and can vary over time. However, based on the statistical tests performed, there was no clear or significant effects found for most of the interactions studied. So, following on from our results, the findings of our study shed light on the impact of COVID-19 restrictions on individuals' mental health and well-being, particularly in the terms of anxiety levels. Anxiety had a significant main effect on the majority of participants during the pandemic, but not before or after COVID-19 restrictions. While it's not surprising that anxiety levels have increased during this time, our studies suggest that the impact of restrictions on anxiety levels is not uniform across the time periods. Specifically, our results indicate that anxiety levels were significantly higher after COVID-19 restrictions than before. These findings are consistent with previous research which highlights the lasting impact of anxiety on individuals' mental health and well-being. However, gender and sexuality showed no clear effect on social connectedness and resilience throughout COVID-19 restrictions. So on to our next slide, our discussion. So encouragingly, our findings suggested that despite different backgrounds and experiences, all groups demonstrated similar levels of resilience, connectedness and anxiety during the COVID-19 pandemic. Our study highlights the remarkable resilience of individuals from diverse backgrounds, as we found no significant differences in the impact of COVID-19 restrictions on their mental well-being. The lack of significant differences between the groups in our study is a promising indication of the human adaptability and coping strategies in the face of challenging circumstances. This study set out to investigate the effects of anxiety, connectedness and resilience on all 3 dependent variables before, during and after COVID-19 restrictions. After analysing the data, we didn't find any significant differences in any of these groups in the terms of COVID-19 restrictions. These results suggest, at least in our sample, that the impact of COVID-19 restrictions was similar across all variables. Whilst our study did not find any significant findings, our results can still contribute to the understanding and the impact of COVID-19 restrictions on different demographic groups, therefore informing future research. So next, I'd like to talk a little bit about the limitations of our study. Although we used a quantitative approach, a qualitative approach may have yielded more in-depth results compared to a quantitative approach because it allows a more detailed exploration and understanding. Qualitative research focuses on participants' perspective and is well suited to studying phenomena such as the COVID-19 pandemic. A larger sample size in quantitative research can result in more reliable studies by increasing representativeness and reducing sampling area, therefore improving statistical power and enhancing generalizability. Future studies need to focus on a wider age range and more diverse population to enhance generalizability and gain a comprehensive understanding of identifying unique factors, avoid bias and addressing health disparities. So I'd just like to focus on the implications of our research. Our study provides an insight into the complex interplay between anxiety levels and mental health outcomes during COVID-19 restrictions. The findings have underscored the importance of supporting individuals' mental health and well-being during these times of stress and uncertainty, particularly those who have had a greater risk of developing depression, substance abuse problems and other mental health conditions. Some of the implications are that it is crucial to ensure that mental health support services are accessible to all individuals irrespective of their sexual orientation or gender identity. However, we do need to focus on minority groups and their access to support in times of crisis. The integration of online therapy group and support groups in times of lockdowns such as COVID-19 and the availability and adaptability needs to be developed further around mental health and therapeutic support services. So in conclusion, this research has highlighted the importance of understanding the impact of COVID-19 restrictions on the mental health across all communities. It is evident that further research is needed to comprehensively address this issue and develop targeted interventions to minority groups. We need to create a more resilient and inclusive society, and it's crucial to address the mental health disparities and promote equality. This can be achieved by implementing inclusive support services that cater specifically to the needs of the LGBT community by providing accessible and affirming support. It is imperative that we continue to advocate for research, support and resources to ensure the mental health and well-being of all communities. By doing so, we can foster a society that embraces diversity, promotes inclusivity, and offers equitable mental health services for all. Thank you very much for coming to my presentation. I hope that you enjoyed it. I'd like to say thank you to my research group, Jonathan Galatio, and Andy Ashar and Emily Morris. Now, do you have any questions?